Good afternoon, it's Mark Larson. It's Tuesday. Sorry I missed our video on Friday because I took a day off, so I was off the grid, and that was really good for me for the weekend. We are doing really well from a COVID-19 standpoint. If you think about a hurricane, we kind of went through the front side of the hurricane with our disease at the nursing home and at Pacifica. Those things are calming down. The Prestige is starting to admit patients again. Pacifica, we're retesting this week on Thursday, but neither one of those facilities have had a positive in over 3 weeks. So we're kind of in the middle of the hurricane, and it's nice and calm and quiet. And the next wall that we have that's going to happen is Central opening on the 8th. So their students come back on the 5th, 6th, and 7th. So on Labor Day weekend, they plan on having 2,100 students in the dorms, single occupancy, and expect to have their enrollment to be pretty close to normal enrollment, although some of those students obviously will be doing things online because their only plan is having about 10% or so of their classes in person. So, but we know our numbers will go back up again. Central's ready for that. They've got isolation and quarantine. We're going to be doing the case and contact investigation here, just like we have been in the past. And so we expect that to go well. They will be testing their athletes when they come back in the next week, even though they're not doing sports until January. So lots will happen with Central. In regards to the K through 12 education, as you know from looking at the governor's website and OSPI guidance, as well as guidance from us at Region 7, there's 3 sets of numbers to be concerned about. It's the incidence rate. So that's the number of cases per 100,000 per 14 days. So easiest way to calculate that is if you knew how many cases occurred in 14 days, let's say it's 25 cases in 14 days. In our county, you'd have to multiply that by 2 because we only have 50,000 people. That would give us an incidence rate of 50. Currently, our incident rate is going down. To open school at all, we need to be below 75 cases per 100,000 per 14 days. That's the red light, the stop. Yellow light is between 25 and 75 cases per 100,000, and the green light is less than 25 cases per 100,000. You can get that by going onto the DOH website. They have a map there. You can click on Kittitas County and you can get a pretty good idea of what our incident rate is. All of the schools in the county, except for Kittitas and the Christian school, have chosen to start online. They are responsible for that decision. They are responsible for the decision of when they're going to switch back to doing something in that yellow light area of 25 to 75, either a hybrid because they can't fit all their students in with 6-foot social distancing, or allowing some students to come back that need special needs. Kittitas School District and the Ellensburg Christian School thinks that they can do it safely, so those folks are putting together their plan. They're petitioning the health department. What we are doing is looking at those plans and trying to make it safer. It's still up to them to make that decision, and they take the responsibility of that decision. We as public health say we don't think it's safe if it's above 75, but it doesn't mean that those are recommendations, not mandates. So those schools can make those decisions, but we are trying to help them make them more safely. So you probably see a lot in regards to those schools, those 2 schools, and hopefully those things will work well. Masking is required in school from the governor, so that is actually a law. They are having to follow masking guidelines or masking law, as well as guidelines on 6-foot social distancing. But they're putting together good plans. I spoke with the principal of Ellensburg Christian School this afternoon and spoke to the superintendent of Kittitas yesterday, and they're working hard at getting things ready for their students. We also see some schools bringing back kids with special needs. Some schools are looking at bringing back kindergartners because they feel like those students need to be back in school, and all of us feel like students will do better in school once we are actually at a spot where it's safe. So don't get confused with incidence rates with the number that you might see on the health department website, which is the number of active cases. Those are the number of cases that we're currently following. That's not the same as incidence rates. Those are just people that still are either in isolation or still sick. So we're doing better. Continue to wear your mask, be kind, watch out for others, and we'll talk to you on Friday. Thanks a lot.